too often, I think both with our patients and when we're linking in with other people to get innovation taken forward, we can answer what's in it for us, but maybe, or even what's in it for our patients, but not what's in it for the person we're talking to. So if it's a finance director, it's about efficiency, it's about good use of resource. If it's for the medical director, it's about improving clinical governance and improving safety. And when it's for our patients, I think we really need to listen and understand and tap into their, and I know it's cheesy, their ideas, concerns, expectations, so that when we're pitching the lifestyle change or the drug intervention or whatever it is that we feel they need to do, it's really aligned to their agenda. And I think the other thing I found really helpful in consultations and also with my teenagers is going on a coaching course. So I'm a qualified coach, and taking my consultations out of the I'm the doctor, I'm telling you to do the space, and into that coaching, supporting, what do you want to achieve and how can medicine take you there space? Again, ideas, concerns, expectations, I found really super helpful.
That's great.
And now for the first question you asked me.
So I think you've got a lot of experience in having these communication strategies that will help people to be better communicator. So if you had been given to teach GP trainees to prepare for the MRC GP SCA, what would you make sure that they learn, Rebecca?
So I'm going to put my cards on the table and say I'm so confused by all the changes in education for GP registrars. I have no idea which bit of the exam is which. So if we're talking about the clinical skills bit, which the bit delivered now by video, my number one tip would be actually do video consultations, because I know you're only assessed on the sort of talky bits and not the examination bits. But actually, you can always tell when somebody's done something 100 times as to when they're doing it for the 10th time, and number 1 to 9 was just practicing with a mate. And I would say, do video consults in lots of areas. If it's Wales, you'll have access to the Attend Anywhere package. If it's Scotland, you can request access to Near Me. If you're in England, lots of ICSs have brought in packages. So see what you can find and integrate it into your normal practice. And yes, it will involve examining people that you don't have to do in the exam, but that is good practice, and it'll just give you this air of expertise that other people won't be able to compete with. I think there's certain things to be aware of in a video call. The first one is lag. So make sure you're not talking over the patient, because even like a microsecond lag can mean that happens. So rather than using all the and all the rest of it you do face to face on the telephone, really accentuate your body language to make that work.
What are the common pitfalls to be aware with remote consultation, Rebecca?
So there are things that are more challenging safety-wise in the remote consultation, and certain things that should just kind of make your antennae start twitching or alert your spidey sense. So I've recently done a big analysis of patient safety events in relation to remote consults. And what I'm about to say comes from that analysis, which will hopefully be published over the autumn. So the first one is repeat remote consultations with the same patient. That's kind of a real area of risk. Like 1, fine, 2, probably okay. If they're phoning back again about the same problem, it would be sensible to clap eyes on that patient. The next point is related to that, and that's that a lot of error has occurred where a diagnosis has been made remotely and then not treated as a provisional diagnosis, but given the same weighting as a diagnosis face-to-face. And things like skin problems, you can easily go sort of down a rabbit hole treating a skin condition you've only seen on photographs, clap eyes on it, go, oh my goodness, that's something else entirely. But not just skin problems, anything that you've diagnosed remotely, I would suggest you retain as a provisional diagnosis until somebody's been seen face to face.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.